It is truly an honor and privilege to be a guest speaker today at your conference. I think I have a compelling story to share with you about my bariatric surgery experience and how, with your help and expertise, we can collectively grow our advocacy and support for the very work that you do. So this is a slide from, I think, Family Guy, and I put it up there because, you know, in the not-so-distant past, I'm not sure that I would have looked forward to today and had seen myself speaking before a room full of highly talented medical professionals from all corners of Connecticut. Even on my drive down here a few minutes ago from Hartford, I asked myself, why me? Why would any of you want to listen to me speak? You know, collectively, you have all likely treated thousands of patients in your practices, yet for some reason I'm the only person on your speaker list yesterday and today that is not a clinician. So let me say this: my journey, my struggle, my emotions, my pain, my recovery, my successes are truly no different than that of any of your thousands of patients. I believe that I am here today because we have an opportunity to learn from each other and to advocate for what we know, what we believe in, and that is to help others change their lives and to beat the disease that is obesity. I will be 51 years old in March, half a century plus one. On my 50th birthday, I weighed about 10 pounds more than I did 32 years earlier on the day that I turned 18. On my 48th birthday, so 50, I weighed 10 pounds more than I did at 18. On my 48th birthday, almost 3 years ago, I was at my heaviest weight ever, tipping the scales at just over 350 pounds. I could write a lengthy book about the various hows and whys of going from a lean, athletic 190 pounds at 18 years old to a morbidly super obese 350 pounds at 48 years old. About going from a lean 32-inch waist to a rotund 48-inch waist, and from a 44 regular suit jacket to a 56 portly. I could write a second book about the hundreds of diets I tried and failed at, one of which you're going to see photographic evidence in a moment, where I would lose those first 10, 15, 20 pounds while I starved to death in the process. And I could write a final third book about the truly strange food combinations that I endured because someone said it might help me lose weight. The most unforgettable of all was raw string beans and egg whites, which nutritionally is not a bad choice, but probably not a standalone for weight loss. For anyone living with obesity today, or for those who are also obesity survivors, they could no doubt write similar volumes. At 18, I was an athlete and 190 pounds, and that's a picture on the left from a chamber choir that I was part of. It was the only good picture I could find that I wanted to show of when I was 18. And this is me 10 years later on my wedding day with my beautiful wife at 290 pounds. You know, at 18, I was a young man who took care of my body. I liked the way I looked, and I ate healthy foods. I couldn't necessarily afford designer labels, but I took pride in how I looked. And as time marched on into my 20s, I had completed my education, started a career, met my wife. And the day I got married, a relatively short 11 years later, at age 29, I was approaching 290 pounds. And I rented a tuxedo for my wedding in the largest size I had ever worn. I had gained 100 pounds in 10 years, but as the saying goes, life was good. Into my 30s, I began to experience many of the same challenges a relatively young but no longer truly young person would face. Career options, buying a first home, starting a family. I also became increasingly aware and uncomfortable with my increasing size. My career at the time had me in front of executives and television cameras doing a lot of public speaking. My wife and I had also started a family, so I started exercising again and started paying more attention to the foods I was eating and how much of those foods I was eating. Through a medically supervised diet program at age 40, I lost nearly 90 pounds, which you can see evidenced in these photographs. But the diet was unsustainable. The nutritionally complete prepared foods were expensive and didn't taste good. The diet required massive amounts of supplements, and at least for me, and probably many others, it was easy to defeat by simply eating whatever I wanted. Just as quickly as I had lost the weight, I regained it, and a bit more. At 42, I was over 300 pounds, a weight I had never been before and one I never freely acknowledged. And despite my ballooning weight, my career advanced, my children were growing, my wife and I were happy. I ran for my first elected office on the Board of Education for Watertown Public Schools in 2011, and I won. I also picked up the name Big Guy. My colleagues called me Big Guy, my coworkers called me Big Guy, my friends called me Big Guy. Even my children called me Big Guy Daddy. Now, of course, this was certainly not used in any offensive way towards me. People were simply describing what they saw in front of them. But I can tell you that deep down, I hated that nickname. It hurt, and it was offensive to my very core. Big Guy. In 2014, I ran for my first state elected office as the state representative for the 68th House, which encompasses Watertown and part of Woodbury. And I was as big as I would ever be in my life. I knocked on 4,000 doors during the summer of 2014, and I walked more than 100 miles. I didn't lose a single pound. I huffed and puffed my way up and down hills in my beautiful hometown of Watertown and neighboring Woodbury. To this day, I'm not sure how I did it. I'm not sure how it didn't kill me. But alas, the election came, and Big Guy won. Some of my new colleagues in the Connecticut State House were also physically big people, and I was quickly inducted into the Big Guy caucus. I recall looking back at the many photos of the campaign and one day saying to myself, wow, Eric, you are really huge. My supersized clothes were getting bigger and tighter, not bigger. I could hear myself breathing when I'd climb a flight of stairs. I most certainly did not like the way I looked. I found it increasingly difficult to get out of bed in the morning without pain in my ankles and knees. Worrying about the so-called future and how my weight was impacting my overall health consumed my thoughts. And I was deeply concerned about the lack of a good role model that I was not providing to my two boys, and whether or not I would even be around to see them grow into young men. These worries, my physical body pains, my now regular appearances in a much more public place in my legislative district and in the State House, they were the so-called perfect storm that made me finally realize I needed genuine medical help. I was not simply overweight or fat or husky or just a big guy. I had a disease, an addiction, one that afflicts millions of people across our country, but one that not until very recently was even officially classified as a disease. I had morbid obesity. You are the experts, of course, but I know that the medical community uses the term comorbidities to describe the other ailments and diseases that you might have as a result of a primary disease or disorder. For morbidly obese patients, those comorbidities, of course, include heart disease, cancer, stroke, diabetes, kidney disease, and suicide. And of course, not until recently has the medical community even agreed that morbid obesity is the cause of these comorbidities, not simply a condition. And this, of course, was a significant change in how morbid obesity, my disease, this disease, the disease that you treat, is viewed by the medical community, by insurance companies, by employers, by state and federal governments, and by the public at large. This photograph was taken 3 hours before I went to the informational seminar at Midstate Medical Center. That's how big I was when Dr. Ben Brahim saw me for the first time wearing that nice suit that he mentioned, or jacket that I was wearing. I am no longer embarrassed by how I look. But most importantly, I know that I'm healthier, I feel good, and God willing, I will see my children become successful adults and have the opportunity to someday spoil my grandchildren. As the saying goes, life is truly good. My journey likely sounds familiar to those of you who have heard from all of your patients, regardless of where they may be in that journey. Some of your patients have just attended that informational seminar. Some are years out from their surgery. Some have lost loved ones who are struggling with their comorbidities of this terrible disease. But we are truly fortunate to be surrounded by wonderful programs here in Connecticut through our many outstanding hospitals and their teams of bariatric doctors, nurses, and staff. All of you in this room today. But alas, that is not enough. We must change the way people think about obesity. We must change the notion Oh, by the way, these are current pictures. I think I skipped a note in my slide. So I just want to take a pause from my notes. The upper left-hand corner was the walk from obesity back at Hubbard Park last fall, and then some pictures of my family and I. And that was, in the upper right-hand corner, is my wife and I participated in the Shamrock Shuffle, which is a very short walk, run, jog race that takes place in Watertown right around St. Patrick's Day. It's a fundraiser for local charities. And I participated in that. It's the first time I had done anything like that in a lot of years. That was last year. So we must change the way people think about obesity. We must change the notion that anyone who is fat, overweight, obese, a big guy, is in that situation because they want to be, because they like to eat, because it's self-inflicted. We must educate elected lawmakers in state houses and state senates across our great nation to change their views and to change the laws. I came here today to tell you about the first part of my journey. Now, as an obesity survivor, I have the rest of my life, thank you, doctor, for the rest of my journey. I am an advocate. I am living proof of positive changes and outcomes. I look forward to working together with all of you to first bring forth change in Connecticut. Let's make Connecticut first again in something amazing and positive. And then let's bring forth change across our great nation. I thank you again for giving me the opportunity to share my story with you this afternoon. And I thank you all for what you do to improve the lives of the people you care for. Thank you.